This was a fascinating article for me for two reasons primarily. One, the sheer quantity of people that have these high deductibles, the workers now. So explain that. And the second thing is how few people can afford an emergency $400 check if they need one to pay for medical fees.
Right. So what we've seen is that over the past roughly 15 years, a huge number of American workers and American families are now in health plans where they're responsible for the first $1,000 or $2,000 or sometimes $5,000 or $6,000 of medical expenses before the insurance plan starts kicking in. Now, there are trade-offs to that. It means premiums are lower than they would be if the plan was paying for the first dollar of coverage. But it also means this whole layer of risk has been put on employees.
And as Julia said, there are employees who can't afford it.
Yeah, there's a lot. And what's interesting is that the shift to high deductible plans kind of coincided with deterioration of American household finances. You know, this took place during the housing crash, the financial crisis, and the kind of period of wage stagnation. So there are a lot of families that can't afford emergency medical expenses.
Your line, 41% of people say they can't pay a $400 emergency expense without borrowing or selling something.
Right, and you talked to people for the story who filed for bankruptcy multiple times as a result of this. Why did this happen? Why did and you said we started to see this upswing during the financial crisis.
Yeah, well, so the first thing to understand is that healthcare costs have for years been growing faster than wages, faster than the American economy. So high deductibles were, in one sense, a response to that, trying to restrain costs. Part of the justification was that if we give employees sort of skin in the game, is the phrase that was often used, that they'll be better stewards of their healthcare dollars. So they'll shop, they won't use unnecessary medical services. And I think what we're finding out, or have found out, is that they cut back on good care as well as unnecessary care.
Preventative care.
Preventative care.
Yeah.
Although, I mean, preventative is supposed to be covered, but there are sort of things like if you're diabetic, kind of maintenance medications that control your diabetes. If you don't have money to pay for those, your condition can deteriorate.
And this is really the key thing, because in the early 2000s, people thought this was going to be the future, and we're all going to be these empowered healthcare consumers. And what you say is people just make bad decisions.
Well, I think
or they make the decisions they're forced into, but they're not compelling decisions that make the market more efficient.
Yeah, I mean, it's complex, but I think, yeah, the sort of expectation that this was going to be a magic silver bullet to restrain healthcare costs has not been borne out.
So what's happening now?
Yeah, what's the fix?
So some employers, these things are still growing very quickly, but some employers are beginning to rethink them. JP Morgan's CEO, Jamie Dimon, recently made some comments saying essentially that high deductibles haven't worked, and that company has taken some steps to kind of effectively lower deductibles for some of its workers.
And this is separate to the Amazon, JP Morgan, Buffett tie-up.
Although, Atul Gawande, the recently named CEO of that venture, has also kind of talked about this issue. And, he's a physician, and he's talked about how putting this financial risk onto patients isn't necessarily a good thing for their care.